Hi, my name is Esther Szmutni, and I'm a COPD specialist certified by the American Lung Association. I have a small rehabilitation office actually, in Green Valley, Arizona, and I would like you to get more familiar with four breathing techniques which will help you to get rid of the excessive air, which is a special problem for COPDers, and also help you to deal with anxiety due to shortness of breath and manage your breathing better. These are very important exercises, and we are going to start right now. The first thing I want to show you is the pursed lip breathing. It is a very important tool for a COPDer. You can get rid of all the stale air which you can't exhale otherwise. It slows down your breathing, and it will give you more room for take the next breath. So without talking about it much longer, I'm just going to demonstrate it so you know what I'm talking about. We're going to take in air on a count of 2 and exhale on an account of 4. This gives you double exhalation time, so you can get rid of your extra air. Here we go. Inhalation on 2, 1 and 2. And then exhalation on 4. What happens is that you purse your lip, that's why it's called the pursed lip breathing, and that slows down the exhalation, as I said before. Again, you're taking in breath on 1 and 2, which is, and then exhale on 4. Okay, that's double time. Again, you breathe in and breathe out double. Whatever number helps for you, you use it. We're not robots. This is just something which we came up with numbers, so it would be more helpful to you. The second exercise is the diaphragmatic breathing. The diaphragm is underneath your lung, and it's a muscle. If you don't use it enough, then it will die out, which means that it will be an atrophy and you won't be able to clear your lungs. If you can't clear your lungs, you can't take breaths. So it's a very, very important tool again, and it has to be exercised many times a day. It's also known as a yoga exercise. Okay, you put your hand on your chest and one hand on your tummy, and you're try to follow the following. Actually, you breathe in when your stomach has to move out. The reason for that is because you want to give more room for your lungs to breathe, and you want the diaphragm to move down. Then when you breathe in, when you're exhaling, your stomach would go in. Therefore, you're pushing the lung up and pushing the air out of your lung. In other words, your diaphragm becomes a tool to push air out of your lung. So let's just say this one more time. We're taking the breath in, and now we're pushing it out. And taking it in again, and pushing it out. as you saw, at the inhalation, my stomach went out, and at exhalation, it went back in because the diaphragm was pushing out all the extra air. I suggest that you do this many times a day so you get used to it. It's not easy, but it's a very, very important tool. The third thing we're trying to show you is a huff cough. It's a certain cough which will resonate inside your lungs and brings up all the mucus and the secretion which is stuck in deeper down there. It's a very easy thing to do. Think of your glasses, and when you clean it and you go, okay, it's a little bit more than that, but this is the basis of it. If you take a big breath, keep it for about 3 seconds, then you huff 3 times while you're exhaling. In one exhalation, 3 times you're pushing out air. You might be able to cough right away, but for most people this resonates, and the air movement will helping to bring up the secretion. So this is how it is. I'm taking breath in and holding it for 3, and I do 3 huff coughs. Okay, one more time. We're taking the breath in, holding it for 3, and then we huff. Okay, by this time, your secretion should be up in a place where it's much easier to expel later on. The next is, and the last of the 4 exercise, is the controlled cough. This now, we brought up all the secretion, now we just have to expel it. This is why you need strong, very strong diaphragms. Here we go. In taking the air in, keep it for 3 seconds, and then you, in one exhalation, try to do very strong coughs. This is how it goes. Okay, one more time. Okay, I have to take a breath too. Okay, here we go. By this time, you should be able to expel your secretion. These are natural techniques which you have to exercise and do many times before you be perfect at it. Make sure you have a glass of water next to you and some tissues to expel the secretion, and you will be just wonderful. Thank you.